Program Director in Physical Therapy at Keiser University in Sarasota. And I've been asked to talk to you a little bit about a career in physical therapy. I remember back years ago during Halloween, and it was always like my favorite time of year, and people would ask me, what are you going to be for Halloween? And I never knew. I had friends and people that hung out with me, always seemed to know what they wanted to do, and with me, I never had any clue. I was always afraid to make the wrong costume or make a mistake, and I basically became a monster every Halloween, and I kind of added to it each year. Then what happened over time, people started asking me about my career. So, what are you going to do in the future? What's your career? What are your goals? And it was the same thing as Halloween. I could not think of anything I wanted to do. It seems like people around me knew exactly what they wanted to be. And with me, I was uncertain. I was afraid to make that mistake in terms of going into the wrong career, going to school for the wrong thing. So I started thinking about, what is it that makes me happy? What is it, the most important thing? Because that would be the type of career I would like. And I think sports was always something really important. I loved watching sports, I loved participating in sports. So I thought, oh, I'll be a professional athlete. So that was my first thing. Then my second thing was I loved history. I've always loved history, and I always thought maybe a history teacher, because what I liked with history was it constantly repeated itself. What had happened in the past seemed like it was happening in the future. And then the other thing I wanted to be was either a minister or a preacher, because I loved giving advice. I loved hearing people's problems, and I loved basically putting information together that I had learned to help somebody in their life. And probably the fourth thing that was the most important was I loved helping out. I thought if I could have a career where I could help people, it would be unique. Because when I was younger, I loved, for example, in a winter blizzard up north, shoveling someone's driveway or raking the leaves. And I just had that satisfaction of helping someone. But what type of career was there? So what came up when I first went to school was in physical therapy, because it basically took all of those things into effect. It was helping people. It was history, because you looked at what somebody was doing in the past and how it led to potential problems. And then it was teaching, it was preaching, because the information I learned and I read, I could bring across to help someone alter their life and make changes. And so it pretty much all came together that it seemed like the perfect career. So I went into physical therapy with that in mind, and it's been a very successful career. The biggest thing behind it, though, was that it helped people. And I find through these years of working in physical therapy, the thing that I get out of it the most was making a difference in someone's life. It was not necessarily the money or the job. All of that was nice and all of that was important, but there's some satisfaction in terms of making a difference in someone's life. That you work with someone who's struggling. You look at maybe a grandparent in geriatrics or parents, and you help that family. When you get them to walk again, you get them to move around, you help them. The day they leave and you see them walking out, you know you paid a little piece of that. A smaller part you played, but it made a big difference. And I think that's probably the greatest reward in that particular field. With that, it's also a key to success and to up the ladder of change. There are a number of things you can do once you have that associate degree that you can move into other fields and you do it. In my life, I went from at the physical therapy assistant, I went into athletic training, a bachelor's degree, and then I always enjoyed management, so I went on to that and got a master's in health management. And then I wanted a total change, so I got my doctorate in holistic medicine. Every degree and every experience you have leads to connections which help you, but it all comes back to the field of physical therapy, helping people. I took some side curves. I got a bachelor's in criminal justice, and I worked as a private investigator for a while. I've done a number of things. I worked with U.S. athletes during the Olympic Games, Lake Placid, Colorado Springs. I've worked in hospitals, rehab, clinics, and each place I worked, the experience you gain just helps you with the things you're doing. But the biggest thing I got out of that was that satisfaction that I made a difference. And I think in terms of careers, it's something that I would never change. The other thing, it opened many doors for me that I thought by having an associate degree in physical therapy, that's all I was going to do the rest of my life. But I used it as a stepping stone for other things. I've written several books on holistic medicine. I've worked in the wellness field. I've had private practices. And even in the field, to maintain your license, each year you have to complete, in Florida, for example, you have to complete 24 hours of continuing education. And the big thing with that is on those particular credits, you can specialize in things and get certificates. I've gotten certificates in craniosacral, on Alexander technique, Feldenkrais, all these special types of options that you can put together. Personal training. I mean, you can look at personal training. So once you come into a program and you put this stuff together, that's just the beginning in terms of where you want to go and what you want to do. You want to constantly look at that. And I think the people you meet gives you that experience, that when someone comes along and you've worked with a patient, maybe who was in sales, or a patient who was a teacher, or a patient who was a police officer, basically that experience makes it easier in the future when you see patients like that again. There was a time in my life midway through where I wanted to look for a career change. So I went back to school and I got a bachelor's degree in criminal justice. I worked a year as a private investigator, and then I also took the U.S. Marshal's test, which I passed. And while I was waiting to have an assignment, what was open was Chicago, but I was hoping to stay in Boston. And while I was waiting for that, I went back to school for alternative therapy wellness. So I got a master's degree in acupuncture and Chinese medicine. So basically I went up and down where I constantly changed, but the common denominator was what opened those doors was the physical therapy career. And with it, with every degree I got, with every class I took, with every patient I met, it basically taught me things on how to work with other patients. So it's been very, productive in terms of that. It's a wonderful career, but through all of it, the thing that I remember the most is that the satisfaction I always got when I made a difference in someone's life. And I think in terms of careers, if you're looking forward to something that you want to be, you can leave monster out of the picture, but what you want to do in physical therapy, it's basically a career that you can help others, but the satisfaction you have by making a difference in their lives is one of the best things you can do.